struggling with infertility can feel frustrated and lonely, especially when it seems like every other couple around them is expecting a baby. Novant Health OBGYN Kim Hopkins here to talk about what couples can do to increase their chances of pregnancy. That's today's house call. Good morning to you.
Good morning.
Thanks for being here. This is such a hot topic right now, something that a lot of people are facing and discussing. So first, let's start with what is infertility? Because it sounds so daunting. You think infertile, you're never going to be able to get pregnant, but let's really determine what it is.
Yeah, so we have a definite definition for infertility. So it's when you've been having consistent intercourse for a year and you haven't been able to get pregnant.
Okay, so what's causing this infertility?
So there's lots of different causes for infertility. There can be environmental factors. There could be anatomical factors like your tubes being blocked. There could be hormonal factors like you're not ovulating. And then of course there's medications that you could be on. Then there's always lots of things that could go on with men as well.
So you've hit the 1 year mark. You're going to go talk to your doctor. What are some of the questions you should be asking to determine what is wrong?
Yeah, so your doctor will ask you a lot of questions about, are you ovulating? Are you having normal cycles? Have you ever had any infectious diseases in the past? Are you smoking? What is your weight? Different things like that.
Now, you've had those conversations and you still don't really know where to go. What are some steps that you can take to get pregnant? What can couples start doing after that year mark?
So once you go to so we definitely recommend that once you've reached that year, you go see your OBGYN because they're going to start their workup and they'll start doing different tests. And so from there, they can kind of figure out exactly what is the cause of your infertility. And then depending on what their workup shows, they can decide what treatment you would need next.
I know it just seems like a growing issue. It's like we've waited later in life to have kids, and you mentioned environmental. I've heard things even like electronics in your lap. I mean, you never really know what's exactly contributing, but being persistent and trying to find the root of the issue, because that is just so tough for couples that are there and they're so ready. So any other tips that you want to give couples that are in that moment?
I also want to say there is hope. There's a lot of great technologies. Sometimes people always think that in vitro is what we have to do. But there's lots of things that are less invasive, less expensive that we have to do. The other thing is, if you're 35 or older, don't wait that full year. Come in when you're 6 months, just because we like to start the workup a little bit earlier.
Yes, and there's always another beautiful option too, adoption. Luckily, there are a lot of other ways that you can build your family.
Exactly.
And like you mentioned, Clomid, IUI, all these things out there, and that's why we appreciate technology and the work that you do.
Yeah, thank you so much.
Thanks for being with us. Let's toss it back over to Derek and Terrence. What's coming up next?